Infection control test. Question number 1. Transmission of infectious agents within a healthcare setting requires a certain sequencing of elements that allow infection to occur. What is this called? A, chain of command. B, chain of infection. C, chain of transmission. D, chain of illness. Question number 2. Transmission of infectious agents within a healthcare setting requires a certain sequencing of elements that allow infections to occur. Identify the correct sequence. A, reservoir, portal of exit, method of transmission, and susceptible host. B, infectious person, portal of exit, method of transmission, susceptible person. C, reservoir, portal of exit, method of transportation, susceptible person. D, reservoir, portal of exit, method of transmission, portal of entry. Question number 3. Types of microorganisms that may cause infection include A, microcytes, bacteria and parasites. B, fungi, dirt and viruses. C, bacteria, fungi and parasites. D, diseases, fungi and bacteria. Question number 4. What type of transmission is the most common way infection is transmitted from one person to another? A, airborne transmission. B, droplet transmission. C, bloodborne transmission. D, contact transmission. Question number 5. Which of the following is most likely to be a vehicle for indirect contact transmission? A, alcohol hand gel. B, clean eating utensils. C, prepared food. D, hands of healthcare workers. Question number 6. What is an example of an illness that requires droplet precaution? A, influenza. B, HIV. C, MRSA. D, tuberculosis. What is an example of an illness that requires airborne precaution? Question number 7. A, HIV. B, common cold. C, tuberculosis. D, H1N1 virus. Question number 8. What is the most effective way to prevent infection? A, proper isolation precautions. B, hand hygiene. C, protocols for disinfecting environmental services. Or D, policies for staff to stay home when sick. Question number 9. Alcohol-based hand gels and foams are only appropriate when hands are visibly soiled. A, true. B, false. Question number 10. What are the 2 tiers of precautions to prevent the transmission of infectious agents? A, standard and contact. B, contact and droplet. C, standard and transmission based. Or D, contact based and transmission. Question number 11. Which of the following statement is accurate about standard precautions? A, standard precautions are based on the principle that all blood, body fluid, secretions, and excretions are potentially infectious. B, standard precautions only include hand washing. If more precautions are needed, the appropriate transmission-based precautions should be implemented. C, standard precautions do not require the use of masks or face shields. D, standard precautions are only for use with patients who have been identified as high risk for infection or who are currently infected. Airborne precautions are implemented when the infectious agent is a small particle that can survive in air for long periods of time. That's question number 12. A, true, or B, false? Question number 13. When should you use soap and water hand washing instead of alcohol-based product when performing hand hygiene? A, visible soil is not present. B, visible soil is present. C, transmission-based precautions are implemented. D, alcohol-based foams are always appropriate. Question number 14. Which of the following best describes multi-drug resistant organisms, MDROs? A, infectious agents that may require 2 medications typically used to treat infection. B, infectious bacteria that have developed resistance to medication typically used to treat infection. C, microorganisms that have the capacity to infect many people rapidly. Or D, innocuous bacteria that commonly reside in hospital settings.